Public service employees in Nigeria will be required to show proof of COVID-19 vaccination or present a negative COVID-19 PCR test done within 72 hours before gaining access to their offices within the country or its missions. This directive was issued on Wednesday by the Presidential Steering Committee on the Coronavirus, which added that an appropriate service-wide advisory or circular would be given to guide the process. The committee also urged governments at all levels to increase their vigilance and take measures to moderate activities in anticipation of an increase in large gatherings due to year-end festivities. Joining us now to unpack this is Dr. Philip Arugi, MD Dove Hospital, Lagos. Thank you very much for joining us, Doctor. Let's start with the deadline given by the government to civil servants. Do you think the number of vaccines can go round before the time frame given?
I believe, I don't know if you can hear me well.
Yes, go ahead, doctor, go ahead.
The number of vaccine available so far with the rate of reception from Nigerians, I think is good enough. It's an ongoing thing. As vaccines are utilized, the numbers are replenished. Unfortunately, we are not producing, we are importing. But the federal government so far has not done badly. They've done very well. And as Nigerians are taking, we continue to replenish. I think the number of vaccine available is good enough. Thank you.
All right, quickly, do you think that this might, create room for racketeering, basically? Because the number of vaccines might not be enough, in spite of your optimism.
Like I say, it is an ongoing thing. Measures have been taken to prevent racketeering. As at now, most places where one can access the vaccines are government or public health facilities. The private sector are largely out of it, so I believe that the idea at the moment is to prevent racketeering. But that also produce some bottlenecks, because the private sector provide a significant percentage of health services. So leaving them out provides some bottlenecks. But the idea of keeping private health sector providers out of it is to keep to prevent racketeering, as it were.
Okay, let me just ask this. I know a lot of Nigerians will be wondering, is it possible for government to implement or enforce this resolution it has taken? I mean, we have over 200 million citizens.
We do not need to immunize 200 million citizens. We do not need to do that. Even at the moment, children below the age of 12 are not even allowed to receive the vaccine. And if you look at Nigerian population, you look at the distribution of population, you find out that we have lots of children below 12. So children below 12 are not allowed to take. So that segment is already off the radar. Again, even amongst the adults, it is not really necessary to immunize 100% of adults. We just need like about 60%. Once we get up to 60%, we're able to develop a herd immunity. And once we have herd immunity, that will be good enough for us. So I don't think it's necessary to immunize 100%.
All right. Do you think that the Nigerian government... All right, I guess network is trying to interrupt us again, but let's see if we can squeeze this one in quickly. Do you think that the Nigerian government is doing enough from your vantage position as a medical practitioner in this country to fight the virus, or has the country just been lucky? Dr. Philip, can you hear
It's
me?
a mixture of both.
Okay.
Yes, I can hear you. I'm saying it's a mixture of both. We are lucky, and the federal government did some things quite right. Nigeria came fourth worldwide. It was like a miracle. The protocol Nigeria adopted was praised, commended world over as a very viable protocol. And again, we actually have a population. I don't know why people say heat, weather, and all that. Those are postulations that people are putting forward, but I don't think is any of those actually mattered so much. But we just one way or the other, we're lucky.
All right, I'm afraid we'll have to leave it there now. Dr. Philip Oragu, MD Dove Hospitals, Lagos, Nigeria, thank you very much for your time.
Thank you.